Let's continue. Madam Secretary, I want you to meet Teresa O'Donnell. She's an office coordinator from Powell, Ohio. She says she's leaning in your favor, but has not yet made the firm and complete decision.
Hello.
Hi.
I voted for Obama, but then my health insurance skyrocketed from $490 a month to $1,081 a month for a family of 4. I know Obama told us that we'd be paying a little more, but over doubling my health insurance cost has not been a little more. It has been difficult to come up with that kind of payment every month. I would like to vote Democratic, but it's cost me a lot of money. And I'm just wondering if Democrats really realize how difficult it's been on working class Americans to finance Obamacare.
Wow, thank you for asking me that, because may I ask you, before, were you buying your family health insurance in the individual family market? Were you getting it through an employer? How were you insured before?
Purchasing it privately because we've both had bouts of unemployment.
So you were going to a broker and
Yes.
buying a health insurance policy. Mm-hmm. And in effect, it nearly tripled after you went on to the exchange and bought a policy under the Affordable Care Act. Is that right?
We could not do that. It was much more expensive than just purchasing private insurance from an insurance company.
So you're still buying the private insurance
Yes.
directly? Okay. Well, first of all, let me say, I want very much to get the costs down, and that is going to be my mission, because I do think that for many, many people, but there are exceptions like what you're telling me, having the Affordable Care Act has reduced costs, has created a real guarantee of insurance, because if you'd had a pre-existing condition under the old system, you wouldn't have gotten affordable insurance. So it's done a lot of really good things, but it has become increasingly clear that we're going to have to get the costs down. And what I would like to see happen for you and your family is that if we can get the copays down, the deductibles down, get the prescription drug costs under control, that you would find an affordable plan on your exchange. And one thing that I would like you to do, and I'm not saying it's going to make a difference, but I would like you to just go shopping on that exchange. As I understand it, Ohio has the federal exchange. Is that right, Joyce? Because they did not set up a state exchange. So you have the federal exchange. And to go on and keep looking to see what the prices are, because we have to get more competition back into the insurance market. One thing that I want to work on with my friends from Congress who are here is we've got to get more nonprofits that are capable of selling insurance back into the insurance market. You know, Blue Cross and Blue Shield used to be nonprofits, and then they transferred themselves into for-profit companies. And there was some effort made under the Affordable Care Act to get some competition from nonprofit institutions. Some of them worked and a lot of them didn't. I want to know what we can do, because if you could get a range of insurers, some of who were not for-profit companies, that would lower costs. So there's a number of things I'm looking at. And what I want to assure you and your family of is I will do everything I can as president, working with members of Congress where necessary, to try to get the costs down. But I do want you to keep shopping, because what you're telling me is much higher than what I hear from other families. And so I want to be sure that if there's a better option out there for you, you're going to be able to take advantage of it. And then I'll work as hard as I can to get the cost down for everybody. And that includes prescription drug costs, which are skyrocketing, and increasing costs for everything else.
All right, we're going to go to Gail Saunders. She's a shot caller, big baller, CEO of her own PR firm, and she's leaning towards your